Good afternoon. My name is David Gonzalez Rice. I'm Senior Program Manager at the Connecticut Coalition to End Homelessness. It's my pleasure to welcome you to our 18th Annual Training Institute and Conference. This session is a roundtable discussion on police, social in homeless outreach. So just to remind you, I'm sure some of you have been in the previous sessions, but if you're just joining us, this session is part of our week-long conference with the theme of Housing Equals Justice. We're taking the opportunity here that COVID has presented to do a remote offering, to run instead of simultaneous sessions face-to-face. We're doing a week-long of one panel, one keynote, one roundtable at a time. And looking especially hard at areas around social justice, economic justice, racial justice, where housing and homelessness are especially relevant. So really want to encourage you after this session to keep looking at the schedule for other sessions and keynote events that are of interest to you. Want to give a special thank you to our presenting sponsors for this session, Bank of America and Zillow, who generously have made it possible for us to host this event. So let me say a little bit more about our presenters, and I want to provide a little bit of context here too. So here at CCEH, we've been having ongoing conversations with some of our partners in law enforcement, including the Department of Emergency Services and Public Protection. And as we've been discussing throughout the day, we're having a national conversation and in many of our communities across the United States right now about the role of law enforcement and of community policing in response to various kinds of mental health situations, to homelessness, to other kinds of challenges that we're facing as a society, with the question of, how law enforcement officers can be best equipped to respond when they are called upon by the public to respond, and where are social workers or other kinds of workforces a more appropriate response to the kind of situation that's coming up. So a few months ago, we here at CCH reached out to Commissioner Rovella and to Lieutenant Brian Foley at DESPP, our State Department of Emergency Services and Public Protection, to ask the question, how can we partner up in this moment to really highlight promising practices, best practices in partnering between law enforcement and social workers. And one idea we hit on was to generate some training material that could be of use here in Connecticut. So we know that law enforcement officers in Connecticut get mental health first aid training, that there's CIT or community intervention, crisis intervention training that happens in partnership with our Department of Mental Health and Addiction Services. But it struck us that there's something distinct about homelessness that's not quite captured under those headings. And it struck me in particular, working as I do as part of our community impact team, supporting local communities across Connecticut, that there are organic or informal partnerships happening all the time between staff who are doing homeless outreach work and officers who are working out in the community. And that one really interesting approach would be to highlight some of those relationships as they've already been functioning to date, and look at their successes and invite people doing this work on a day-to-day basis to share with their colleagues and their peers what they would like them to know or what they think they should know as they consider strengthening these partnerships in their communities. So let me just tell you who we've got here in the panel today. I want to introduce Aubrey Minkler, Community Services Coordinator for the City of Bristol. And out of that office, she works to empower city residents through short-term case management and outreach. Prior to this role, Aubrey worked as the Assistant Program Coordinator of the Psychosocial Rehabilitation and Supported Employment Program at Community Health Affiliates in New Britain, Connecticut. And she recently served as the lead facilitator on a project called the Peer Fit Pilot through Dartmouth University, which was looking at cardiometabolic risk reduction in patients with severe mental illness. Also from Bristol, we have Officer Matthew Gotowala. He's served the city of Bristol for 9 years as a police officer, and for the last 3 years as a school resource officer and community officer. He currently patrols Brackett Park, or recently patrolled Brackett Park. I'm interested to hear from him whether that's still an assignment, and works directly in the Bristol Central High School. For the past 3 years, he's also served on the City of Bristol Youth Commission. We have Lori Walling, who's Assistant Program Director for the Center for Human Development, or CHD, in Waterbury, Danbury, and Torrington, out on the western side of Connecticut. She's worked in the mental health field for more than 18 years and started out in her career working with people on the autism spectrum or with developmental disabilities, and then transitioned to focus on mental health, addiction, and recovery. She's been at CHD for the last 6 years with responsibilities expanding to include homeless outreach, especially with the PATH program. And then Tim Finley is an outreach case manager with CHD also. Over the past year, he's been the street outreach worker for the PATH program in Litchfield County and Greater Waterbury, recently stepping into, I think, a pretty new role as outreach coordinator in the Greater Waterbury region. As an outreach worker, Tim strengthens local collaboration to facilitate recovery for people experiencing homelessness with mental and behavioral health conditions, and helps them build sustainable futures within supportive community. I want to acknowledge that, you know, in the way of these COVID times, we had a number of last minute changes and substitutions here. We had Officer Di Giovancarlo, also from out in the Waterbury area, that we'd hoped would be able to join us today, who was not able in the end. And Tim and Lori's colleague, Nico Lopez, who I know that the two of them have this sort of working collaboration. And Nico unfortunately had to call out sick this morning. So I'm really appreciative to Tim for stepping in. And as I said to the group as we were teeing up, there's nobody more than outreach workers and law enforcement officers who I think is accustomed to making last minute changes in response to conditions as they emerge. So really eager to hear from people who are serving our neighbors experiencing homelessness day in and day out. So wanted to start by just talking to my colleagues from the Bristol area. Tell us a little bit about your collaboration, how it started, and what are some recent successes you've enjoyed by pairing up in this way?
Hi, David. So I'm relatively new to my position here in Bristol. In June of this year, I officially became the program coordinator of community service for the city. My very first day on my job, the mayor came to me and said that our homelessness is a great issue and we want you to tackle it. So we really hit the ground running. I was able to meet with Officer Gotowala's boss, who connected us, who said, you know, utilize our officers to go into these harder hit areas and see what can be done. I called dispatch, and Officer Gotowala was the officer that had been assigned to Brackett Park. And he was the one who just really already had built relationships with our homeless people in our city. And these community members who we were seeking to help and serve. He sat with them on multiple occasions over the summer, just really connected with them on a personal level to help facilitate a process for me to enroll people in HMIS and different programming to get them where they should be in their services.
So, Officer Gotowala, tell us a little bit more about how you got assigned to be patrolling in Brackett Park. I think I understand your background was doing the school resource officer piece, and how you approached that as you got started.
So I'm obviously up at Bristol Central High School. So after the school season or school year is done, they put us in parks where kids normally are supposed to go hang out. Brackett Park has very few kids. It has more of the homeless population because the Agape house is right across the street. So they get all their meals from there, their medical supplies, and as well as the places where they're residing in the tents are very close by. So that's kind of their congregating area for the park all day. So I was able to just get some coffee and go sit down with them and learn their stories and why they're homeless and, you know, what makes them, I guess, who they are, and find out where they are living and what services they would be willing to take. So when I got to meet up with Aubrey, it was nice to be able to introduce her to people and say, hey, this person might need so-and-so, this person might need some supplies here, and we're able to build a good relationship that way.
That's great. Aubrey, I know that I was at the table for some of Bristol's developing a coordinated approach this summer. So I think it might be relevant to some of the folks in the audience to know that you're not working under the PATH contract or under a specific kind of either a COC funded or kind of typical funding stream homelessness project. You're a municipal employee who's sort of been assigned to take this on. So could you say a little bit about what kind of getting plugged into that network of homelessness providers in Bristol this summer has looked like?
So our division is Parks, Recreation, Youth, and Community Service that I currently work for. And we've targeted it as a group approach to the homelessness epidemic. It doesn't take one person to end homelessness. So the city has really empowered my office to go in and to see where everyone is and to meet them where they're at in their cycle and their journey through all of this. So they've afforded me the opportunity to really, connect with all of our nonprofits in the area, as well as your office, and to just do the outreach that's really needed in our community to understand where people are. And no one in the city is above asking anyone, to anything. Our own mayor is on the corner asking people, what services do you need? Do you need help? Do you need this? As well as Dr. Medeiros, our superintendent, and my own supervisor as well. He goes out with me very frequently to some of these like harder areas that are encampments and things like that, to really just connect people where they're at.
All right, thanks, Aubrey and Matthew. And I'm aware of a couple of sort of examples from your community. I might want to come back and ask you about in a minute, just to kind of flesh out what we're talking about here. But Lori and Tim, I wonder, the same question to you. What does it look like out in the Waterbury area to be working alongside or partnering with your law enforcement officers out there? And sometimes that's city police and sometimes it's state troopers. So if you could speak to each of those.
Good afternoon, Tim here. We continually get updates from our local police department as far as where our homeless encampments are. Most recently, we had a site that was needed to be addressed due to some city and state work being done. What we'll do is we'll go in and refer them to shelter, get them connected with different services, and we get a lot of information from our local police department as to where the homeless are frequenting as far as businesses and parks and those kind of things. So we get in there and do the outreach and get them plugged into services they may need.
Yeah, Tim, it strikes me as you're talking about that, something we heard, I think, earlier from Katie Mosher McDivitt, is how much communities in other parts of the state or the country might look to homeless outreach teams to identify who's out there, right? And of course, you're working in a setting that's not quite as dense, right? You've got your urban centers, but then you've also got these rural areas you're more responsible for. So it's always struck me about that part of the state that you're often relying on this network of law enforcement officers, including the state troopers, to alert you to, where people are staying outdoors. That way, you don't have homeless outreach staff sort of canvassing or hiking, but you're able to become aware of where people are staying. Does that sound like about how that works out in your neck of the woods?
Is that for you? So I'm sorry. Yes, it's exactly how that would work. There is a lot of places that are unidentified right now. as far as encampments. We're noticing that there's in the Waterbury area, we had a tent city, as some other communities do. We're noticing that the homeless rather be in individual sites located all over the city. So again, we're getting a lot of help with the police department helping with that.
So Lori, I wonder, you've been supervising this work for some time. I wanted to know if there's anything you want to share about how this collaboration looks, including, I know that Nico wasn't able to join us today, but he'd established this practice of attending roll call, which I thought was a really interesting way of building trust and a working relationship. So if you could speak to that as well.
I think when we first started out, it was just very organic. So we also have a center called the Hospitality Center, which is a homeless walk-in center. So they can do their laundry for free. We have in-kind providers that come in and help them out with any legal services, any health and wellness. The health department comes in and we do free showers for them. And through having that center, we just bonded with the police officers that would come by. And then it kind of snowballed into, if there was an encampment that had to come down, let's call CHD and let's get the PATH program out there to move them. And then it kind of grew into roll call. And that is so perfect because we get to meet everybody at the beginning of their shift. And we also meet the cadets that come in as well. And what's really cool about Waterbury is the cadets will come in, they'll learn about the homeless outreach that we do. They're bleeding hearts, they want to help, of course. And then sometimes they go out to different, portions of the state. So we're actually kind of teaching them about homeless outreach and they can kind of take it with them wherever they go.
That's great. Thanks, Lori. So I do want to ask about if you've got an anecdote or an example of how this kind of collaboration has served people in getting off the street or getting the kinds of services they need. Aubrey and Officer Gotowala, I'm thinking about, I think it was a person that you were able to navigate into one of the hotels that Connecticut's been able to put it together. So we were talking earlier today about the fact that our Department of Housing and our state government had contracted a number of hotels around the state to decompress shelters. But that also, it's been a way to help people who are staying out on the street stay safe, stay home, stay safe, right, short of a shelter bed. So is there more you could say about that, or another success you've had at helping somebody locate housing?
Yeah, that was one of our more of our successful stories. We had a young couple that was sleeping in one of our gazebos in our parks. I called dispatch. They sent Officer Gotowala out. When we got there, he had already known them by name, their story, who they were, and what was going on, and was able just for them to trust me. They have a long history of not wanting to go into shelter because of negative experience that they've had in the past. With that, but because they trusted him and just by association with him, they kind of trusted me then too. And we were able to get her connected to 211, and then she was able to get into the Red Roof Inn for shelter. So it was pretty exciting.
That's a good one. We've had a couple of questions come into the chat that I'll ask you about. And I see Officer Gotowala answered one of these. One of our audience members asked about disability diversity awareness training from people living with disabilities, and observing that non-disabled experts and professionals can't quite have the same impact. So just an open question, I guess, about whether that's been available to any of you in your professional training.
I think we're always, actively seeking trainings, and there's been tons of disability trainings that have been offered through the CAN network and different coalitions in the state, and I try to attend them. I mean, I've been on, I think there's 3 trainings I just did this morning through CCEH, so always trying to,
Yeah, and I think the question specifically raising, we might use the language of lived experience as well to talk about people, living with, living with conditions that we're talking about, which could include mental health or other kinds of behavioral health conditions, as well as conditions that qualify as a disabling condition. Officer Gotowala shared he agrees a lot more offerings of that kind are needed. Let's see, Lori, a question to you before we get too far from it. You talked a little bit about roll call. One of the audience members wanted to know more about what that actually looks like. I don't know whether it's called that in every state. And so if you'd say a little about that, and then maybe Officer Gotowala as well.
Yeah, that would be great, because actually Nico is the one that goes to the roll call. I don't actually do it, but I do know that it's that time of day, everybody gets into their shift. Everyone has their assignments given. So Nico gets to learn who the police officers are. They learn who he is. And that's where we just give the information to them. They can have our business cards, our phone numbers, stop by the hospitality center. It's something very quick and easy that we can do to kind of get the word out that we're here to the law enforcement and to have them reach out to us.
And Officer Gotowala, anything more you want to say about that that practice and the opportunity there might be there for someone like a homeless outreach worker to participate?
Yeah, so we call it lineup, and we have had speakers come in frequently. It's right at the beginning of every shift. It's about 15 minutes long, and it's where the officers learn their assignments, talk about maybe issues from the prior shifts in those zones, as well as any trainings we have to do quickly, or talking about if there was a call that we all went on the day before or something, talk about how we can improve on that for next time. But yeah, we have had social workers and other people come in and kind of give us some feedback.
Something along the same lines that our city has done is we've made like placard cards for the police officers to have that they carry with them that have contact numbers of all of the people that they can reach out for homelessness, and who to call if they come up to an encampment or someone that's experiencing these kind of situations, and what to do in that situation. And they carry them with them wherever they go.
Resource wallet cards, yeah. We have one follow-up question. It says, it's a great outcome hearing about a couple getting into Red Roof Inn and off the street. That's wonderful. It's also short-term. What happens next? So I think that each of your teams has some experience of helping people move into housing or a longer-term setting, either from shelter or right off the street. So Aubrey, I'm aware of a concrete recent example in your case, and then I'll ask Tim and Lori if they have a similar anecdote to share about what are we doing, after a shelter placement or when a shelter placement just isn't a short-term option.
So the really cool thing about my position is that I'm able to offer short-term case management too. So I don't just, drop them off at the Red Roof Inn and then part ways. We really are able to help follow them and through the course of their next few months to a year of homelessness or getting into housing. So this particular individuals, we were able to then locate family for them out of state, and we actually put them in our vehicle, in our van, and we took them to where they wanted to go. They had confirmed that their family was ready to take them in, and they were really excited, for a fresh start. So we were able to take them 2 hours and 45 minutes to their new location where they wanted to be. And they were so excited and so grateful.
I think that speaks as well to something Kim Osher-McDivitt was saying earlier about being in the headspace of problem solving with people, right? Not to say, well, we don't have a vacancy in a rapid rehousing project, so we're out of cards, right? But to keep asking and talking about what kinds of other options there might be. Lori and Tim, can you think of an example of, again, kind of navigating somebody into a longer term solution?
So yeah, the biggest thing would be getting them into shelter. After they're into shelter, we also provide some case management. Some folks are literally coming to us with just the clothes on their back, having no IDs, having no birth certificates, any identifying information, social security cards. We try to start with that, get all their IDs, their information. We also connect to family members when possible. The housing process it's a long process. So we try to get them connect to as many services as we can as we're going through the housing process. Like Lori said, we do have a drop-in center here in Waterbury where they can come and get connected to services, get clothing, just hang out. We have hang out with peer support specialists and different programs that help them on a day-to-day basis. Because of the housing process does take a period of time, sometimes 8 months up to a year, depending on what vouchers we have available. So yeah, getting them connected to services and seeing them through the case management process until they get housed.
Thanks, Tim. And so outreach is often in a good place to do some of that sort of fundamental work, right? IDs can be such a critical barrier to even the most basic of services, or to kind of, making that next step. Lori, do you have anything else you wanted to share there? I do have one question here, just more about where the Hospitality Center is located. So one.
The Hospitality Center is located in Waterbury. I don't know if everybody knows, we did have quite a fire back in February, the end of February. So we actually had to relocate across the street. So we're at 690 East Main Street in Waterbury.
Great. Let's see. So I did want to ask, I mentioned before that mental health first aid, crisis intervention training, there are a couple of areas where law enforcement officers currently get some substantial training in interacting with people who are experiencing mental health symptoms, or are having big feelings or difficult times. And what I wanted to put to you, and I'll start with Aubrey and Officer Gotowala, is how do you think, or what would you want to know your colleagues in law enforcement to know about how homelessness is distinct, right? It's not always this, the same kind of an acute short-term crisis, or what might be distinct about partnering with people who are doing homeless outreach or homeless services differently from, say, another mental health agency or mental health crisis team.
So as far as wanting my colleagues to know, I worked third shift for the first 6 years of my career. And I mean, I dealt with a lot of the homeless for shopliftings and for, being intoxicated in public and stuff like that. So now being in this position, being able to actually sit down with them and learn more about them and learn why they are in the position they're in. A lot of them start off just like, we did. Went to school and everything, and then a lot of them got into either drug addiction, alcoholism, maybe some family issues or medical issues that caused them to be out on the street. So they all started out like you and I, and then they hit a bump along the road, and this is the life they're in. And a lot of them were reluctant to ask for help because they want to try and do it themselves. But we just have to let them know that we're out there to help them as well.
That piece, Officer Gotowala, you shared about kind of the self-reliance value that our culture really enshrines. I think that's such a critical piece, because we will hear sometimes from community partners that in an exchange with somebody who's living outdoors for a time, you'll hear, well, this person told me that that's where they want to be, right? And I think it's important to bear in mind that our cultural values can make it easier for somebody to think about the situation they're in as something they chose or as an expression of their autonomy, right? So really appreciate what you shared about just kind of sitting with people long enough to get to know where they're coming from and what their history was. Aubrey, how about you? You worked in other mental health services, other mental health fields. What do you think is distinct about working with people who are experiencing homelessness or partnering with homeless sector providers?
That's a good question. So at least where I worked before, we had homeless that would come into the facility that I worked at. So it was just like accumulation of everyone together. But working more outreach and more hand in hand with like the police department and things like that. I was reading through the questions that people had asked, and I think a big thing is just trusting that, you know, the police officers, at least in our community, they want to help. They want to, you know, get these people services and things like that. And they were so eager to learn, and nothing had really fundamentally been laid out for them before. And every single one of the SROs that I had an opportunity to work with over the summer were like, tell me more. Like, I want more information. Like, where else can I send them? What else can I do for them? You know, and things like that. And now we have like a call list as to, you know, the officers are on patrol who are calling after hours and things like that. And, you know, they don't want to arrest people. They want to get them into shelters. They want to get them into treatment and things like that. And our city has piloted the COBRA project, you know, and that's really fundamental in making things successful as well.
Could you just say briefly what the COBRA project is? I know, but.
So it's a community response project. So if someone is going to be arrested, they can be offered treatment at any course in the time to defer them from being arrested.
Thanks, Aubrey. And then same question to Lori and Tim. What is it about interacting with people experiencing homelessness that differs from what some of these other sorts of mental health first aid or crisis intervention lenses might bring? Were you thinking about maybe what a mental health crisis team might be responding to, or some of the crisis response workers who ride along with officers in some municipalities?
Hi, sorry about that. We were fighting over who was going to answer first. I have to absolutely agree first off with Aubrey, because we really find the same thing here in Waterbury. The police officers, you know, the mayor is just so in tune with our community and with what's going on. And that's one thing that I would tell everybody is really, if you guys can get your law enforcement in, if you can get the government in, help out in any, it's just amazing. It's amazing. From what I'm seeing less arrests. They do want to help. If they find an encampment through Parks and Rec, you know, they're getting a hold of us. The state troopers have been getting a hold of us. The CIT officers have been absolutely amazing. So they're the ones that come out to help us with crisis, you know, and that's for any mental health issue or for homeless issues. And I think that it's made a huge, it's made a huge service available for these clients that might not ever reach out because they're afraid of law enforcement. When you're driving, you know, past Hospitality Center, for example, or if you're in a park and you see an officer sitting down and talking to one of our homeless guys, you know, that resonates, and it's going to be shared citywide, you know, so I don't think they're scared of law enforcement as much here in Waterbury as they used to be.
So that speaks to one of the questions from a participant asked about advice for building partnerships where outreach workers respond rather than a police response initially, mentioning some communities where history of negative interactions or negative experience could lead to some of that fear or avoidance that you're talking about. So I do want to point that audience member and anyone else who's interested in following that up further, that on Friday we do have a session called Help Not Handcuffs, Improving and Reducing Police Response to Homelessness and Behavioral Health Crisis, looking more closely at alternatives to arrest. And that we've got Kim Caranda from our Department of Mental Health and Addiction Services and a few others on the panel who'll be speaking to that on Friday. So take a look at the schedule. We're going to dig a little further into that area. Let's see. And related to this, I had one question come in about CDC's guidance to avoid clearing encampments, so to speak. And Lori, you'd mentioned earlier that there are times when an encampment can pose public safety or public health issues. I just want to acknowledge now, I think even sessions I attended on this with National Alliance to End Homelessness, this is a really tricky area, right? So there are United States Interagency Council toolkits and protocols that spell out checklists and timeframes for how a municipality or a jurisdiction can responsibly approach putting an encampment or a place where a number of people are staying outside on some kind of a timeline and a path toward having no homelessness in that location and all of the things that you would need to do to get there. So I just want to encourage us all to bear in mind this is never an easy process. There are also strident opinions about whether the process should ever be framed in that way with a deadline, as it were. But also recognizing the reality that most cities and jurisdictions have some kind of a mandate to respond to public safety or public health issues that they can pose. So I'll let people know that the CDC, maybe I'll, while I'm asking one of you to speak to this, I'll find the link and put that guidance in the chat just so you have access to it. But there was written guidance coming out from the CDC encouraging communities to avoid clearing encampments and instead to partner with social service agencies on lining up needed services for anybody who was staying outside, all framed under the heading of the current pandemic and needing to avoid scattering people to parts unknown, as it were. So wanted to ask, I think, any of you who's had experience of working in that way to speak especially to what that looks like right now under governor's emergency.
So we recently had a pretty large encampment on one of our railroad tracks. It was private property, and that's how I was connected with your office. But it took a community approach. On our call, we meet every Wednesday, and there are, I'd say, 6 or 7 different agencies, providers that are on this call who collectively come together, and we work directly with our health department to make sure that all of our guidelines were carried out correctly.
Right, so it's involved this sort of cross-sector partnership and trying to find all of the resources that are available to offer alternatives. I think helping navigate people into hotels was one short-term solution. I wanted to ask as well, Lori, you started to answer this, talking to social workers who might be interested in partnering more closely with law enforcement. What kinds of things should they bear in mind when doing that? Who might they approach? And what would be the value in doing that? So Lori, if you have more you want to say about that, and then we could.
No, that's a really good question. I mean, honestly, I think it's just walking through the front door. They're not going to turn you away. Whenever we go to the police department, they've always been excellent. You know, we'll leave brochures and flyers for them to hand out to the officers. But I mean, if you just want to get in, just walk in the front door.
And let's see, Officer Gotowala or Aubrey from the Bristol perspective? Same question.
I think just spending time like talking, you know, hands-on as to like where the need is and asking, you know, for the help is really important. Just saying, you know, this is our harder hit areas. These are where people are. What can we do to connect the offices together?
We have a question in the chat Q&A about work being done to help inform businesses, companies about avoiding criminalizing homelessness, and what role police departments can play in that. How could it become a statewide effort? So I'm trying to think about where you've got downtown business associations, or, I mean, I'll share that one issue that comes up in national conversations about police response is that when a community member calls 911 or the police to report a disturbance, that puts police in the position of being responsible to respond, right, and to do something, right? So that's one of the situations. I think the question here is about especially kind of downtown kinds of spaces. So anything from perspective of either of your cities that would speak to that?
Yes, we do have a proactive approach with going to our local businesses in the community, as Lori said, handing out flyers and information to where they could contact outreach workers, path workers, as opposed to calling 911 or calling law enforcement. We've been very active in this as of recently through the COVID and beyond, to getting community involved in connecting the outreach workers and our hospitality center as a resort to calling the police officers as they have their hands full with other things.
That's great. So you've been able to get some marketing out to suggest to people what other lines they could call.
Absolutely.
Officer Gotowala, it looked like maybe you had something to say about this?
No, I was just going to agree with Aubrey on that end.
Well, I have a quick follow-up for you. So you mentioned working third shift, right? This was a question coming in our chat box. You mentioned working third shift, and Tim spoke to having other numbers to call apart from 911. But nighttime and weekend shifts are when more calls come in to 911 or to the police department involving people who are experiencing homelessness, but homeless outreach may be less available at those times. So what would you want to see from the homeless services sector, to support having somebody other than a police officer who could be that first response or who could go with you to be part of that first response?
That's a good question. Well, we would like somebody on, a 24-hour call thing for the city. However, it's not really possible at this point. So we've been using 211 to come out. We'll call them ahead of time, come out, or if we're with the person already, we'll sit and wait with them, have 211 come out. We've brought individuals back to the police department and let them sit inside and wait until 211 got there. But at this point, 211 is mainly our go-to on third shift on weekends.
That's interesting to me. I think we could probably get a quick answer. I know 211 is piloting some crisis response in a few communities and has not scaled that up statewide. Aubrey's nodding a little bit. Do you know whether that's a 211 pilot where?
I don't think it's actually 211. I'm sorry.
No, that's
that
all right.
that comes
That is
out.
a
I think that
possibility.
people assume that Marianne Farr is from 211, but she's technically not. But she is definitely someone that we lean on a lot for support. She comes out readily when people need her. But on the weekends, our own councilman has gone out to help when things, have gotten tough. And, recently I can think of a story when an officer called me on a Sunday night. We were able to make an appointment with the clients the next day, and he made sure that they got to the appointment. He was waiting for them to remind them to come the next day to their appointments with me.
But this speaks to something. So I know Marianne Farr, and Marianne Farr is a now half-time, bumped up from 10-hour a week outreach worker out of St. Vincent de Paul, Bristol, who's been doing that for a few years and splits that job with her role as the administrator of a supportive housing project, scattered site supportive housing project. You all have kind of cobbled together on a really small scale something that we will be talking about on that Friday panel, which is the idea that what if 211 or a similar kind of service could deploy outreach staff, right, in a way that's analogous to, preferably 24/7, as Officer Gotowala stated, what law enforcement is doing. So, excuse me. I'll just observe too that Marianne, I think, also works not under a PATH contract. So City of Bristol doesn't have you may be in a catchment area of a local mental health authority that has PATH outreach workers, so I don't want to be too specific, but you're basically pulling together a municipal funded position, a position that's funded with a combination, I think, of downtown business dollars and some of the discretionary funds at the shelter, and building this small homeless outreach system as you go. Let's see. Oh, I have one question to Hospitality Center again, Lori. We talked a little about the funding sources in Bristol. So what's the funding source and the staffing at the hospital?
Oh, so I call my hospitality center my biggest program and also my smallest, because it is the smallest funded, but it's the largest program CHC could probably have. We have over 700 people that come through our doors unduplicated a year that are homeless. So it is a rather large program. Our funding is through the state and through small cities grants. The mayor's helped us out with that as well. So we've been doing really well with growing a little bit more money-wise, hopefully.
You're talking about CDBG, small cities?
Small cities, yep.
That's great. It is one model to think about in a region like yours, right? Again, where you have this kind of broad geography. That's something like a drop-in center that works like outreach, although it's located at a site, can be a way to identify a lot of people efficiently. And then, as our communities are, I think a lot of that CARES Act funding that came in has been allocated and spoken for, but, think about creative uses of small cities, CDBG like that. I know some of the communities around Connecticut have used it for diversion navigators who take referrals from the CAN or coordinated entry. And I'll always say that, the difference between a homeless outreach worker and a CAN navigator is title, right? In theory, the tasks that they do are quite similar. How are both Bristol and Waterbury, here's a question from our Q&A box, thinking about cold weather season? Right, here we go. With fewer warming centers open, where do you expect people outside will be brought other than jail to get warm and stay inside? So wondering, Tim and Lori, maybe you'd like to take that one first?
Yeah, sure. So right now we're actually working on that as we speak. The shelter, because of COVID, took a hit and they have to go down to half capacity. So we actually did create an overflow that they will be able to go to when the shelter becomes full. Also, what we have, whenever the cold weather protocol is initiated, the hospitality center either becomes a warming or a cooling center. So we have hopefully enough room with COVID and with this overflow that they're putting together, that we'll be able to get everybody off the street that wants to be off the street.
That's great. We're gonna have a moment of COVID realness here. My wife's going to pick my son up from school and my keys are in my sweatshirt pocket, I wanna say. We're working from home. How about in the city of Bristol, cold weather planning?
So we are discussing planning this week with a bunch of our community providers. Christine from St. Vincent de Paul has kind of spearheaded that project, which she has a past history with a nonprofit in the area, Agape House. And she's really knowledgeable of this area. So we're super lucky to have her on our team and kind of be spearheading the project alongside of the city.
And I know that our State Department of Housing has basically looked to local communities to signal what they're able to pull together, in your own municipality or jurisdiction, and then to figure out where gaps need to get plugged. This has been an ongoing conversation in Connecticut because our year-round shelter system is somewhat more formalized and tends to have more direct and transparent support from our Department of Housing, and the winter arrangements are very different community to community and winter to winter, especially this winter. So last I checked in on this from the statewide perspective, our Department of Housing was looking to the organizing agencies in each coordinated access network or regional coordinated entry to kind of map out what was available community to community, and then name how big the gap was. So know that that's really an urgent and continuing process of planning. So let's see, with a few minutes left to go, let me just ask about challenges. So a couple of different, I mean, we know that the challenges of doing this work are many, especially now. What would you say in, especially where you've been working together with, between a police department and your social worker role? What have been some of the biggest barriers to overcome, but then also in collaboration, right? Like, let's be honest, there are cultural differences, institutional expectations that make these kinds of collaborations, like, they're valuable, but can also be tricky. So if you're able to speak, about what some of those tensions might be, or sources of confusion and things people might watch out for in these kinds of partnerships going forward.
It's a small challenge, I think, on the scheme of things, but the fact that I don't work 24/7 is sometimes hard for a police officer to understand. They're so eager to learn and to get people homed. I'm under the bridge and I have these people right now. Where can I take them? And I just don't have a spot right this second for you to go to, unfortunately. And understanding that, it's a work in progress. It's a long, it's a marathon race, to get these. It's not the short sprint. And educating and understanding that, I think, is the biggest challenge that we face, is that it's not an immediate cure overnight. But there's definitely things that we can do, and we can continue to build these relationships. And I mean, it's been 3 months that we've been, really piloting this project in our city, and I can't imagine what it's going to be like in 3 years, so it's really exciting.
One way we would put that is to say we don't have access to housing on demand, right? In a lot of the sessions this morning, we talked about the mandate that homeless services has to want to house people quickly and to exit from homelessness quickly, and the reality that just affordable housing stock and especially what we're hearing lately about the just logistical challenge of finding a property manager or landlord who wants to sign a lease right now in these times are real constraints on our ability to deliver on that. So a major difference to, say, calling in a clinician to assess somebody who is maybe experiencing a mental health break. The homeless response system is not always able to do something immediately. How about Tim and Lori, challenges, barriers that you want to highlight for us?
I'm echoing, sorry. I wouldn't call it a challenge or a barrier. I guess me personally, what I would like to see more of is the police force attending more of our community meetings. We do have an opiate task force. We have a community care team where we actually look at the frequent flyers that go into the ERs and the EDs, especially, we're targeting those that are homeless so that we can get them adequate services, get them paper ready for housing, if we can. And having the law enforcement be involved in those meetings is going to give them more of a heads up on what they're working with out in the streets. So I wouldn't call it a challenge. It's just something that I would just personally like to see them do more of if they possibly can. So
getting your partners on the law enforcement side to those sort of existing collaborative spaces like a community care team or any kind of existing regional collaboration. Yeah. Tim, did you have something?
Yeah, so I agree with Lori, or Aubrey also. It is a challenge due to limited hours. I mean, our officers have these issues going on first shift, second shift, third shift. It's obviously, like Aubrey said, we can't work 24 hours a day. It does become a challenge to get people connected to services at 2, 3 o'clock in the morning. And also, I do have to agree with Lori, is maybe if we get some of our officers of city government more involved in the programs that we do have set up may be a little better to get insight from them and to help out the whole situation. Realizing the severity of the problem with not only the addiction, the mental health piece of it, a lot of variables there that need to be addressed, I guess is what I would say.
There's a dynamic here, I think maybe I'm uniquely able to speak to that. I think we've reached out to, there's a number of communities we're talking to where similar kinds of collaborations have evolved and that we might want to be spotlighting in our training. There can be a dynamic of like, whose initiative is it anyway, right? Sometimes you've got more than one homelessness task force in a city or jurisdiction, or more than one opioid response team, and different players have an interest in having the ball or being seen to take initiative. So that's not to fault anybody. It's just to recognize that the imperative there to be doing something and how to kind of work through that to develop an equal partnership where everybody's focused on the mission. I see we got our 5-minute warning. I want to thank everybody for taking time out of the incredibly important work that you're doing day to day to join us here today, and just really appreciate your continued commitment to our neighbors experiencing homelessness. Okay, and I want to remind everybody that the next session coming up, we've got, please do take a look at the schedule for the rest of the conference. Our next session is a tour of the crisis response system. So I was happy to take a turn to talking to the people doing the homeless outreach piece. And we're in these tour of the homeless crisis response system. We're giving you an opportunity without having to leave your computer to see and hear from people who are delivering services in the field, how Connecticut's coordinated approach works, screening people in a housing crisis, referral to shelter, and so on. So that's coming up immediately next. We do, to avoid overlapping between one session closing and the next opening, we do ask you to leave this one session and then go and find that registration link in your email, which you should have gotten with your conference registration. And we'll hope to see you there and at the rest of the conference over the week. Thanks so much, everybody.